have a couple more people just coming in right now. Maybe we'll just give another minute. All right. Well, welcome to Child Abuse Prevention during COVID and beyond. And today we are very fortunate to have two amazing people to share their work and also really guide us through a conversation about COVID. Danielle Wondra, Senior Associate from Children Now, and Merritt Beckett, Senior Program Manager from the California Family Resource Association, which we will be referring to as CFRA for short. And let us get started. So we're going to just point out a couple of features on Zoom that you'll be using today, but everyone is muted, and we do that just because of background noise. But when we have breakout sessions and when we have conversations, we will unmute you and you will be able to add to the conversation. So you can see the little microphone there. That is where you will mute and unmute yourself. You can also share your camera if you'd like. It's always fun to see who's here and who's joining us today. So thank you for those who do. If you do not, you can always stop the video. That's okay as well. And to communicate with us and others, you can use the chat function, which you see here down on the middle of your screen, and you'll be able to chat. If there's anything that comes up for you and you need to contact one of us, you can see we all have the strategies logo behind us. Let's see. You can directly chat us if there's any questions or issues that you're having. You can also use your reaction buttons. So if there's anything the speakers say that resonate, you can do a high five. I see they added reactions. It used to just be the thumbs up and a little high five, but now you can add a heart, you can add a laughing emoji. Sometimes it's nice to know if our jokes are landing, so please feel free to use that if you'd like. This webinar is brought to you by Strategies TA and the generosity of the Office of Child Abuse Prevention. Strategies TA is a collaboration between the Children's Bureau of Southern California and the Child Abuse Prevention Center. So we're lucky that we're able to collaborate together and do this great work. So I want to introduce you to our team who is on today, and we are here to help support you. Sarah Lacroix is the co-director of Strategies TA from the Children's Bureau of Southern California. Troy Nichols, who we'll hear from later, is a Senior Technical Assistant Specialist from the Child Abuse Prevention Center. Rosalind Dong is also a Senior Technical Assistant Specialist from the Children's Bureau. Anvi Din is our wonderful event coordinator from the Children's Bureau of Southern California. And I'm Lydia Marquez. I'm a Senior Technical Assistant Specialist and also your facilitator for the webinar today. And I am from the Children's Bureau. One of the things that is really important to us at Strategies TA are our guiding core values, and all of our work is anchored in these. And those are accountability, equity, community, collaboration, and strength-based. So these are the values that we anchor all of our work, and you'll see that theme reiterated through all of our webinars as well. I'm sorry, that was community voice. I can't see everything on my Zoom screen. And so now I'm going to hand it over to Troy Nichols to explain our learning exchange cohorts.
Awesome. Thank you, Lydia. Can you guys hear me okay? Awesome. So greetings and salutations. Welcome. I have the esteemed pleasure of explaining and then beginning the process, as well as being a facilitator of our learning exchange cohorts. The purpose, a path to deeper learning. It's a growth process. We started out with learning communities. Many of you who have been involved with strategies in the number of iterations, strategies 2.0, now strategies TA, may be familiar with our learning communities. Well, we've taken a different approach, and the learning exchange cohort concept has been birthed. And our hope is that it's going to not only kick off with these webinars, but also be a support system where we're supporting the prevention planning teams that already exist, as well as prevention work throughout the state. Participant driven. Member-driven is our focus now. Gatherings to build that capacity and deepen that knowledge as a group. Can you scroll back one moment? I just want to go through the topics really quick. So what happened was we had a number of topic areas that came up in our November Strategies TA kickoff. We had some questions for our groups, and those are the topics that are listed here and will be the topics of our webinars, which are the kickoff for our learning exchanges. And the topics are, we had this one already, our rural communities, some of the work that needs to be done there where distance and access to services is a challenge. Today, we're going to embark on our COVID-19 conversation. What's it looking like for us? What's it going to be after this? How do we do our prevention work and provide prevention services in this environment that has been so ever-changing? Community engagement and building communities, our building community resiliency toolkits, Wendy Ellis and the work we've done with her. Resilience itself. We know that our families, as well as us as workers, need a parallel process of having resiliency be a part of the work that we do. And then finally, equity. And as you saw when Lydia was giving our opening, equity is definitely one of our core values, as well as with the current socio-political environment and the awareness that is coming through our communities. Equity is a conversation we felt like needed to be a topic area. Next slide. So with that, our learning exchange cohorts, and they're called cohorts for a reason. We want you to come back, and we want you to come back consistently. We understand your busy schedules. But we also understand that when we give devoted time to a topic area that may be a challenge for us or our communities or the work that we're doing, if we put that time in, it will make our work more effective and efficient down the road, and that's our hope. So just real quick, for those that were aware of our learning communities in the past, what's the difference? Why are we making a distinction between learning communities and learning exchange cohorts? First of all, it's participants as members. Right? We're not just participating, we're a member. And when you become a member of something, there's a different level of investment, and that's our expectation. It's going to be member driven. Although I'm the facilitator for the COVID-19 learning exchange cohort, it's going to be member driven. We're going to come to consensus about topics, about projects even. Now, does anybody need more work? If you raised your hand, I was going to kick you out of the training, because nobody needs more work. That's not our expectation. Effectiveness and efficiency, problem solving, discussions with people who are doing the same work that we're doing in our own shop. So that's where that member-driven concept comes from. And topics are going to emerge from us. We're not going to come to you and say, we think we know what's best, here's the topic. We're going to ask you, and then we're going to come to consensus, and then we're going to talk about it. So the difference in those learning exchanges is it's going to be an in-person or virtual group of people who share this common problem, who share common problems or passions or interests. And we're going to come together for 2 sessions through this fiscal year till July, and then there'll be topic areas that we address going into the new fiscal year. So you can expect 2 from each of those topic areas going through July that we mentioned in the previous slide. We're going to learn from each other. We're going to talk about trends about child abuse prevention, child abuse and neglect. We're going to follow this prevention plan that we're working on with OCAP and meeting the needs in the larger field and throughout California. So what I'd like you to do is, there are 2 opportunities for you to show interest, and I'll get back in contact with you to be a part of this process, even if it's just planning or to become a member. One is you could chat, because we're going to save our chat. I'll get back in contact with you. The first steps will be some sort of doodle poll just to meet, to see when we can get one done in the next few months. The second opportunity, you're going to get an evaluation. In that evaluation, you'll be able to speak to your level of interest. I can see the faces that I can see on camera. I know you're all going to say yes, because you all look super interested. Those that I can't see, hopefully you'll jump in and do the same. So my ask is that you take some time to think about our topic areas. You decide where you fit the best. You also decide if your workload is manageable enough for you to become involved, or do you just want to benefit from the outputs? Because that's okay too. And we're going to acknowledge those folks. So I hope to hear from you soon. Again, I'm Troy Nichols, and thank you for your time.
Thank you so much, Troy. We will have some time at the end of the webinar today in order to answer any questions you may have about the Learning Exchange cohorts. So just wanted to let you know as well. So I want to introduce our first presenter, Danielle Wondra from Children Now. Danielle is a senior associate at Children Now working on child welfare and foster care policy with a focus on the intersection of child welfare and K-12 education. Children Now is a statewide policy advocacy and research organization that takes a whole child approach, covering the full range of key children's issues from prenatal through age 26, including early childhood development, education, children's health, childhood trauma and resilience, foster care, and youth justice. Danielle has a background in research, policy, and direct service, and she's been an advocate for vulnerable youth for more than 15 years. I'd like us to welcome Danielle Wondra.
Thanks, Lydia. Hi, everyone. Good morning. I'm going to talk a little today about our work to understand how California's children are doing during the pandemic in terms of their safety. So specifically, whether they're experiencing more or less abuse and neglect during the pandemic because of the unique circumstances that it's put us all in. When the pandemic first hit California and stay-at-home orders were put in place, we know that schools closed their physical campuses, and we saw drops in the number of children who were attending their regular doctor visits. Next slide. At Children Now, we became concerned when we started to hear from some counties that they were experiencing significant drops in the calls being made to their child abuse and neglect hotlines. Some counties saw a 40 to 50% drop in calls. With schools closed and fewer kids participating in social activities or visiting their doctors, there were a lot fewer eyes on kids. And teachers and doctors are obviously mandated reporters who must report any signs of suspected abuse to child welfare. But of course, a drop in calls to the child abuse hotline does not necessarily mean a decrease in actual instances of child abuse or neglect. It could mean instead that we're missing 40 to 50% of the abuse that is taking place. Also looking at the particular stressors of the pandemic, they could suggest that there's a greater risk for child abuse or neglect during this time. So for example, because of the stress and isolation of being stuck at home, the anxiety of enduring a public health crisis and possibly having loved ones becoming sick or even dying from COVID-19, there's also economic hardship, high unemployment rates, a lot of people losing their jobs and money. And we know that high unemployment rates are historically associated with higher rates of child abuse and neglect due to the stress. In addition, there's a lack of access to outlets for stress, and folks can't access the resources that might help mitigate some of those stressors. We also heard anecdotal reports, usually through news articles or interviews, about some locations across the country that were seeing spikes in the number of kids experiencing abuse or spikes in the severity of the abuse that kids were experiencing. For example, one of those was in San Diego County. Rady Children's Hospital reported seeing an 82% increase in their outpatient visits. And that's through referrals to the Chadwick Center, which serves children who have experienced or witnessed abuse. And they saw a 75% increase in inpatient consultations, and that's among kids who were hospitalized at Rady's Children's Hospital. So we started searching for data that could help us get a better handle on how the pandemic is impacting kids' safety. And we discovered that there was really no data immediately available that gave us a full picture of what was going on. So I'm just going to kind of walk you through, yes, thank you, some of the places that we looked and what we found out through that. So one place we looked was at statewide child welfare data to see how many kids are coming to the attention of the child welfare system, how many are entering the system, those types of things that might tell us, has there been an increase in abuse or a spike in the severity? So the California Child Welfare Indicators Project processes all county child welfare system data and puts it into public reports that are accessible online. But the public reports available didn't include any data from the pandemic until 6 months after the pandemic started. So already it was taking that long to even see what that data looked like here. There's also a lot of limitations to how you can view the data and how you can break it down for privacy purposes. A lot of that is pretty wonky, so I won't go into detail about that here. One of the data points that we looked at is maltreatment allegations. So just to be clear about what these things mean. So maltreatment allegations are reports of suspected child abuse or neglect. The Child Welfare Agency assesses whether the report meets criteria to require an investigation. And actually a large portion of allegations are not investigated. They're evaluated out and it's decided that they don't reach the level of abuse or neglect. The ones that are investigated, there are different possible findings or outcomes of the investigation. You might find that the abuse is substantiated, meaning there is evidence of abuse or neglect. It could be unfounded, meaning there's no evidence of abuse or neglect. And then some allegations are found to be inconclusive, so they can't say for sure one way or the other whether there's evidence of abuse. And then if a case is substantiated, meaning there's evidence of abuse, the child may have a case opened and then potentially enter into the foster care system. Next slide, please. So this slide here is showing the number of children with one or more maltreatment allegations. So it's comparing the number of kids with one or more reports of abuse or neglect during the year ending September 2020, which is the bar on the right. And that includes 6 months of pandemic data compared to the previous year ending September 2019, which is on the left. So just to be clear, this is a count of children with allegations, not a count of the reports or allegations themselves. So a child could have multiple reports made by multiple people. They would still count as one child here. So there were about 477,000 children with allegations in the year ending September 2019, and about 416,000 children with allegations in the year ending September 2020. So looking at the difference there, we see that the number of children with one or more allegations is down about 13% in the year ending September 2020 compared to the previous year. So pandemic, this would suggest that during the pandemic, there have been fewer allegations. And this is just looking at the wide view of who is coming to the attention of the child welfare system. Next slide. Yes, thank you. And now looking at the kids who make it further into the system. So this is the total number of kids who entered foster care during the year. So that means they had their allegations of abuse substantiated by the child welfare system, and it's been decided that they need to be placed under the jurisdiction of the court. So as shown in this figure, in the year ending September 2019, on the left, there were about 27,000 kids who entered foster care and about 23,000 entering foster care in the year ending September 2020, which is on the right. So looking at that difference again, sorry, can you go back? Yeah, I'm almost done. The number of children who've entered foster care during the pandemic was down about 14.5% during that year that included pandemic data compared to the same time the previous year. I just want to point out when we look at entries broken down by the reason that the child was removed from their home, removals due to sexual abuse are down 33%. So that's really suggesting that we are probably missing actual instances of sexual abuse. But thinking back to the hotline calls, compared to the 40 to 50% drop in hotline calls, the number of children with allegations of abuse and the number of children entering foster care didn't decrease nearly as much, which could suggest that there's some over-reporting of abuse at the hotline level, and that maybe the severe cases are still getting through to the child welfare system. But it could also mean that there's abuse happening and we're not catching it. So just to be clear, the child welfare data here don't really tell us for sure whether there's more or less abuse, just that there's fewer allegations and fewer kids entering the system. So where else can we look to get more information or a different perspective on the issue? Okay, next slide, thank you. So next we looked at data on child fatalities and near fatalities that result from child abuse or neglect. So this might be able to tell us whether or not child abuse has become more severe during the COVID-19 pandemic. Just as background, counties report fatality and near fatality data to CDSS. Those reports must be made within 10 days of a determination that a child's death or near death was a result of child abuse or neglect. And those determinations are made by different agencies. So it can be child welfare or probation, it can be law enforcement agencies, it can be coroners or medical examiners. And the timelines and definitions for those determinations vary. In some cases, it can take months to resolve a case, and then that final determination that a child fatality or near fatality was caused by abuse or neglect is then reported to CDSS. So you can see there's a lot of steps that have to happen before we would know from this data what was going on. There's a lot of data points that can slow down that process. And then there's also a significant delay before these data become available at the statewide level. The most recent state report available through CDSS reviews the data for year 2015. So we were realizing that on the whole, that wasn't really going to give us an answer. It just takes too long to get that information. And just to note that there's different definitions of neglect or guardianship and other key things that factor into this, different definitions at state and county levels. So the reports that are, that might be at a child welfare agency, those might not all get into the CDSS statewide report. So there's still these differences that are going to impact what we can see. Next slide. So even though this is old, I just wanted to quickly go through this statewide child fatality data just to show you kind of the realm of the numbers we're looking at. So in 2015, there were 104 child fatalities resulting from abuse or neglect in California. And you can see over the years how that number has fluctuated. So it goes up or down a little bit here and there. Next slide. Same thing here. So this is looking at the near fatalities. There were 80 maltreatment near fatalities resulting from abuse or neglect in California in 2015. Again, numbers are pretty small. So even if we had these data more immediately, it would be hard to know if there was a spike because these numbers are fluctuating anyways. There would have to be a really overwhelming spike for us to notice it in this type of data. Next slide. So we tried searching for more recent data at the county level. And this was also difficult because a lot of the publicly accessible data is not available very quickly. The one large county that does have some of this information readily available is Los Angeles County. They have a child fatality data website that shows the number of child fatalities reported to the child welfare agencies that were due to abuse and neglect. And this can be either confirmed abuse or where there's a reasonable suspicion that abuse contributed to the death. So in 2019, you can see here there were 71 fatalities due to child abuse and neglect in Los Angeles County. In 2020, there were 52 fatalities. So this includes data through November 30th. So comparing these two, we see that the numbers in 2020 as of November 30th were at about 3/4 of the total child fatalities in 2019. So this might suggest that there's fewer fatalities, but it's also important to note that this doesn't include the December data yet. The cases take a long time often to resolve, so those determinations will be added into the data later. So again, we can't really look at this and know for sure what's going on. And we also want to know whether there's been an increase. That's okay, you can go to the next one. We also want to know whether there's been an increase in child abuse that may not rise to the level of a fatality or near fatality. So anecdotally, as I mentioned, some places have seen a spike in cases or increase in the severity of cases of abuse. For example, I mentioned earlier, Rady Children's Hospital in San Diego, but hospitalization data is not publicly available very quickly. Again, California Department of Public Health has statewide hospital data, but the most recent is 2015. And again, there may be abuse happening that doesn't rise to the level of hospitalization. So again, remember I mentioned that the number of children removed from their homes due to sexual abuse has dropped considerably. So we're likely missing some hidden abuse that isn't getting to the eyes of teachers and pediatricians in hospitals. We also considered looking at domestic violence data. But again, this is very tricky in terms of we don't just need domestic violence data, but we need information about when there are kids involved in a domestic violence situation. And the data doesn't get that specific at a publicly accessible level statewide. Next slide, please. So where does that leave us? Honestly, with a lot of unanswered questions. We don't know enough yet about child safety during the pandemic, and we probably won't know until it's over. The available data doesn't allow us to make any clear conclusions yet about what is happening. There are multiple data sources to see how children are doing at various levels or different severities of injury abuse, as I went through some of those, but there isn't a way to see all of that data together to get a full picture of child safety. And earlier I mentioned that the stressors of the pandemic, like high unemployment rates and isolation, anxiety, that those stressors might suggest that child abuse and neglect would increase during the pandemic. On the other hand, some folks have argued that the particular situation of the COVID-19 pandemic could actually serve as protective factors. So the fact that there were federal stimulus payments, additional unemployment benefits, and other extensions of benefits that we don't necessarily get during other economic downturns. The overall economy has been staying afloat to a greater extent than we expected initially. So because of those potentially protective factors, we might not see as much abuse as we might during a typical economic downturn. It's really still too early for us to know the total numbers. We're still waiting for reports and determinations to come in. So we don't know if there's underreporting now or if there was overreporting before the pandemic. Next slide. So before I end, I just wanted to cover some high-level recommendations around data that would make it easier to see how kids are doing. And so some of these are very high level, the first two. So one obvious recommendation is that we need quicker access to more data. The publicly available data are too slow to be useful in this situation. And to facilitate timely access to data, our various systems would need to be integrated and streamlined in the way that they're sharing and presenting their data, including data on child fatalities and near fatalities, hospitalizations and injuries that result from abuse and neglect, and domestic violence cases that involve children. And obviously a lot of other fields as well would need to be integrated into that. And these are really big asks, obviously. They would take a lot of time and money for these to happen on a statewide level. So this last recommendation is really the one that's the most immediately doable. So local collaborations to start understanding what's happening in local communities. So perhaps working together within counties, creating a structure that brings together relevant people, from relevant fields, some of which I mentioned, bringing them together to the table to see how they can each provide a piece of the picture. They can talk in real time about the trends that they're seeing and their part of the field, and not having to wait for the pandemic to be over to have a better sense. This could also facilitate, more open channels of communication between, say, child death review teams and children's hospitals, child welfare agencies, child abuse hotlines, community providers, all bringing their pieces of the puzzle together to help each other better understand what's happening in local communities during COVID. So that is the end of my slides. Thank you. And here's my contact information if you want to reach out or if you have any questions after the webinar. Thank you.
Great. Thank you so much, Danielle. That was actually very helpful in understanding what's happening and how we can use data to prepare us for life with COVID and after. So I'll give just a minute to for folks to write down information. I know some of you have some questions for Danielle. We'll have some time at the end to have her answer those. Troy is collecting those questions that have been put into the chat in a Word document so that we can have those available. But just to let you know, we are going to move on to our next part. So we have the privilege of hearing next from Merritt Beckett. She is she is the Senior Program Manager at the California Family Resource Association. And I am trying to, pull up her bio here so I can share that with you all. It disappeared on me, so give me just a second. Sorry about that. She has over 15 years of experience working in public and nonprofit management to improve the health and welfare of women and children. She previously served as Regional Director for First Things First in Arizona and Manager of Community Health Education for HealthNet in California. She holds a Master's of Public Health and a Master of Social Work degrees from the University of Michigan in Ann Arbor, and has twice served in the Peace Corps in Nicaragua from 1998 to 2000 and in Zambia from 2015 to 16. So I'd like us to welcome Merritt Beckett.
Thank you. Thank you so much, Lydia. That's a very kind introduction. And I also want to thank the strategies team for inviting me to join you today, and just share that I'm pleased to have the opportunity to share more information about how family resource centers are responding in COVID-19. As Lydia mentioned, I'm with the California Family Resource Association, which we call CFRA. And CFRA was founded in 2005. And we're a statewide membership association, primarily of family resource centers and networks, but broadly organizations that serve children and families. Our main purpose is to advocate for programs and policies that help family resource centers and networks support children and families, and advocate for policies that benefit children and families. And the main way that we do that is by convening partners for shared learning and planning, and also by supporting the development of networks and coalitions to achieve greater impact. All right, next slide. So it is my understanding that many of you are already working with family resource centers, and that can look quite different from one county to the next in terms of what the relationship and work with family resource centers looks like. But that also family resource centers, may be new, and that some of you may be less familiar with family resource centers. So I did want to just offer a brief introduction and share that family resource centers are community-based organizations that prevent child abuse and neglect and strengthen families, and also provide a wide array of services and supports for children and families. They're available in many or most communities, but not necessarily all. And the services are available for all families, but generally they especially serve vulnerable families and children and families that maybe are experiencing challenges from systemic racism, poverty, immigration issues, mental health issues, and trauma. And Family Resource Center was somewhat recently defined into statute. And some of you may recall Senate Bill 436, and many of you may have even assisted with the advocacy efforts to get Family Resource Center defined in statute. But on the slide here is the sort of formal definition of a Family Resource Center in statute. It's part of the California Welfare and Institutions Code. It was and is a significant achievement for the field because having it defined in statute allowed for family resource centers to receive state funds. Did I catch everything? Yes, okay. I think we are going to go to a poll now. So there we go. So we have a couple poll questions. The first is, do you have a family resource center on your CAPC? Yes or no? And the second is, in your current role or organization, are you collaborating or partnering with family resource centers? Yes or no?
And for those of you that may not be familiar, a CAPC is a Child Abuse Prevention Council. All right, so we're going to end the poll in 5, 4, 3, 2, and 1. So it looks like 69% of folks do have an FRC on their CAPC, and 81% are collaborating or partnering with family resource centers. Sorry, let me share that with everyone.
Oh, okay. I mean, that looks like a pretty clear majority to me. So that's really exciting. That's encouraging. We wanted to just also provide an opportunity for you to share some. So if you could just in the chat box share just some examples of how you're working with family resource centers and what you see as some of the benefits. And then if my team can help me monitor the chat.
So it looks like some folks are using Delaney shared housing resources, food assistance, clothing assistance, parenting classes. Deanna shared, oh my goodness, it's going so fast. We currently refer students and their families for help financially, for example, with food. Look like lots of assistance with connecting families to resources, problem solving beyond the capacity of what a school can provide. Looks like lots of concrete support for families and resources into the community.
Excellent. So those are some terrific examples of the types of things that family resource centers do in communities. Again, it really varies from one community to the next. It's typically the intent to be responsive to the needs and priorities in the community. But just some examples broadly are parenting classes, home visitation, job training, substance abuse prevention, violence prevention, services for children with special needs, mental health and family counseling services, childcare, literacy programs, and then as well assistance with basic needs, including food and housing and things like that. So next slide. Even though family resource centers have really a long history in the United States, they've been around since the late 1800s. In some ways, it feels like it's taken a crisis to reveal even more so how important family resource centers are. And some of you may recall in April of last year, Governor Newsom announced $42 million in new investments to protect young children who are at heightened risk for abuse and neglect during COVID-19. And at that time, he said that every child deserves to grow up in a safe, stable, and nurturing environment free from abuse and neglect, and that family resource centers play a critical role in preventing child abuse and neglect, in strengthening children and families, and in connecting families to an array of public and private support systems of care. So of that $42 million that was more broadly for child welfare services during COVID-19, $3 million was specifically directed to support family resource centers and meet essential needs of children and families during the crisis. And it was a requirement of that funding that the funds be utilized by June 30th. And so CFRA, California Family Resource Association, was selected to administer and distribute those funds. And because of the need for a quick turnaround, our existing partnerships with family resource centers and networks was really critical to get those funds out efficiently and effectively. Next slide. The next slide. Okay. So because of the trusting relationship that family resource centers already have with families in their communities, the family resource centers were automatically the place that that families went anyway for help during COVID-19 soon after the stay-at-home orders were initiated. And so just examples of some of the emergency services that were provided in the early days of COVID-19 were material items, and this included food, diapers, and hygiene supplies, personal protective equipment, which you might recall there were severe shortages of toilet paper. So really distributing some of those essential needs was critical. They also provided assistance with isolation needs. So that included telehealth, remote case management, virtual home visits, and also, Facebook Live meetings and fostering connections through social media platforms, as well, making that transition to provide parenting resources, parenting classes, and support groups, again, through online or virtual methods. And then also really critical was the referral and application assistance to apply for local, state, and federal benefits programs like unemployment and connecting folks with food and housing. Next slide. So for the emergency funding for family resource centers, CFRA, the California Family Resource Association, we contracted with 82 lead organizations, and those 82 organizations represented 349 family resource centers throughout the state. Most counties were served, 54 out of 58 counties were served through these efforts. And in the 10-week period from April 13th through June 30th, just over 117,000 individual beneficiaries were served. And that included 6,401 foster family beneficiaries, and also 2,773 Indian tribe beneficiaries. So you can see in the figures here that by far the most needed and requested service was food and essential supplies, things like diapers and formula. And family resource centers almost universally reported very substantial, significant increases in the demand for food banks and food pantry services and things like that. Next slide. Existing relationships with our key partners like First Five were really critical to getting the funds out efficiently and effectively as quickly as possible. And of the 82 lead organizations that I mentioned, 17 of those were first five commissions. And those first five commissions included 96 family resource centers that helped to distribute emergency supplies and services. And through their efforts, over 13,000 individuals were served in 10 weeks. And just examples, you can see the picture here. One of their sites provided a drive-through, but some of the examples was they did food distributions, drive-through, as well as home deliveries. Some of them provided COVID-19 testing and contact tracing. They provided information and education related to immigration services and also additional community resources, as well as virtual parent support groups. And one of the key successes that they shared with us was that blending and braiding funding from multiple sources was one of the ways that they were able to stretch the resources further and serve many more families and children than they had initially anticipated. Next slide. So another example that I wanted to share from one of our colleagues, Hillary Beyer. She's with the McKinleyville Family Resource Center in Humboldt County. And she shared that one of the things they did was they developed and implemented a rapid assessment community needs survey to assess both the needs of individual families and as well identify countywide challenges. And as a result of that assessment, or those assessments, they determined to increase the output of their food pantry by more than 88% in 1 month, just because of the critical demand for food. They also provided utility and rental assistance, as well as diapers, formula, and cleaning supplies, and again, personal protective equipment. And they also noted that one of their priorities is and was to increase parental resilience. And they described really the importance of providing opportunities for families to make decisions about what things are most important to them and make decisions about their own lives. And so to really ask people what it is they need and provide that space for agency, and then to be responsive to those needs once they're identified. Next slide. Another really great example I wanted to share is from Contra Costa County, and the Family Resource Centers and networks, and again, the First Five Commission really mobilized their family resource centers and networks to advocate with their city councils for eviction protections. And as a result of those advocacy efforts, they had multiple city councils in their county who did implement eviction protections so that residents who were unable to pay rent due to COVID-19 were not able to be evicted as a result of that. And then just another thing I wanted to mention is that during COVID-19, vulnerable families experienced extreme challenges meeting even basic needs. And that as a result of that, many were at an increased risk for homelessness, food shortages, and loss of power. And so family resource centers were and have been, continue to be instrumental, influential in providing essential services to prevent some of those more severe outcomes from occurring. Next slide. Also wanted to share some good news. Some of you may have heard that family resource centers are again included in the governor's proposed budget. And so specifically in two areas. One, there is a proposal to include $61 million for COVID supports for child welfare again, and specifically family resource centers are noted within that. It's not known yet what that amount might look like. And then as well, family resource centers are included for $5.3 million to implement a navigator model. And this funding is, it indicates that it's directed for families that have children with disabilities. And again, it's not known yet exactly, what the rollout of that will look like, but CFRA and our partners are in conversations with legislative analysts and with the budget committee members to really learn more about how that's going to develop and offer assistance, and again, advocate for sustainable funding for family resource centers. Slide. So that's the end of my slides. This is my contact information. I definitely would invite you to reach out to me if there is any support or information I can provide. And also, I did want to mention again, we are a membership association, and we would love for you to join us if you are interested in learning more about some of the benefits of membership or ways that you could be involved and participate with our efforts. Reach out to me, and I will also put a link in the chat for more information about that.
Great. Thank you so much, Merritt. That was really helpful in really understanding how family resource centers can help support families during COVID and beyond. With that in mind, we wanted just to ask a few questions, and just due to time, I wanted to just share these. What lessons learned from COVID-19 will help you in your work to strengthen families, and what next steps to support wellness are most important? And so we would like to know this, and so please pick one that you want to answer. And you can go ahead and put your answers in our chat like we've been doing before. So if you wanted to share, what are some things that you've learned? I know for our practice, we learned that we could have more online meetings to help people save time with travel, especially in rural communities. So, and I think some next steps for us to support child and family wellness are really to be sure to use a trauma-informed care approach, as well as strength-based. So that's definitely something I'm thinking about. So feel free. I know it takes a minute or two to get stuff typed in. So Susan shared telehealth and virtual meetings. Work with our families, and we will keep aspects of this moving forward. Yeah, we have families that are busy. Sometimes they can't come in, so I love that option. We need to bridge the digital divide so we can continue serving folks virtually in an effective manner, especially in rural communities where internet is not something that we oftentimes have access to. So we have a lot of people talking about technology, having a community hub for resources, learning how to get resources out quickly. So I think that that's important, because this will not be the last emergency or even natural disaster that we experience, especially in this state. Also, someone pointed out that while the online is helpful, it's also shown a light on the inequities surrounding access to reliable internet. And I think that's such a great point. Equity is, like Troy mentioned earlier, one of our topics that we will be doing for our Learning Exchange Cohort series. And I think that that's definitely something that a lot of us have been experiencing and seeing. So lots of great stuff, resources, connections, relationships, education with regards to stigma around mental health support. Please log on to CFRA if you're interested in getting your FRC connected with them. Looks like there's lots and lots of things that are happening, things that people are learning, and I love the sharing. And again, we are capturing this as well. So thank you all for really participating. The other thing I want to mention, I forgot to mention in the beginning, was that this webinar will be recorded and uploaded into our Strategies TA YouTube channel. So I highly encourage you, if you wanted to look back on some of the questions or some of the contact information for Danielle and Merritt, it will be on there, and that should be up within the next week. All right, so thank you all for those very thoughtful answers to these questions. And I'm just really happy to see people are relying on FRCs for support and really accessing them as part of a resource for your families. So some next steps. After this webinar, you will get a SurveyMonkey in your email, and that will have a link to let us know how we did. So please let us know how we did so that we can continue to improve the content we bring to you. But it'll also give you an opportunity to share what your interest is in the learning exchange cohorts. We really want you to tell us if you want to be part of that so that we could reach out to you and let you know when the next one will be. Again, like I mentioned before, this is going to be on our YouTube channel, and all of our webinars that we are currently holding will be there. And so you can see even the ones that we've had done in the past. To stay connected to us, we really highly encourage you to sign up for our newsletter at www.strategiesca.org. So those, if you wanted to know any events that are coming up. Well, I just want to again thank my two presenters, Danielle and Merritt, for sharing their work, sharing their knowledge with us today. I think it was really helpful in getting the conversation started around COVID-19. I feel so fortunate to have these folks share with us some of the data and also just some of the things that are going on right now with COVID. So hopefully the discussions you had today really helped connect you with others who are doing the work and not feel so isolated right now. I know that can happen. I wanted to leave some time for us to be able to have any questions answered by either Danielle or Merritt, or our staff regarding the learning exchange cohorts. So I know there's a lot of activity happening in the chat, so please feel free to go ahead and put your question in the chat. If you want us to unmute you, you can raise your hand. I think you can put like a little high five up there. And then we can have Anvi unmute you. So. If there's any questions, I know there was some before, Troy, that we may want to start with.
I can certainly highlight them. One quick, easy one that came through is an updated list for family resource centers by area. So is there any sort of thing like that? What is the cost for membership? Marcella asked about that, but that's a contact with Merritt. Merritt will be in contact, or we'll give her your information. So those were more logistics with regards to Merritt's. Danielle, did you want to possibly field one or a few of the questions that we started? Yep, she needs to be unmuted, whoever is the power.
Yeah, thank you. Yeah, Troy, do you mind reading? Do you have those questions? Do you mind reading?
Yes, I do.
Okay.
Not a problem. So the first one is there a correlation with the increase in suicide cases that are being reported in school-aged children during the pandemic?
I would say as a data person, I don't know if I want to say specifically that yes, there is a correlation, but obviously the same stressors that could lead or that we might expect to lead to more child abuse or neglect could also be resulting in the higher rates of suicide. You know, folks are stuck at home, they don't have access to the things, especially for young people, for kids who don't have access to the resources they usually get at school or to their friends and having those usual social outlets. So I definitely think that a lot of those same stressors can contribute to both of those things in different ways.
Definitely. The second one, it came from Jamie. Jamie, you may need to help add context to it because I think this was a question based on the presentation. It says, does this include situations where children remain in the home but still are under jurisdiction of the court? I'm not sure what.
Yeah, I remember, I think I know what they're talking about. So I think this is related to the number of children who entered foster care. And yes, that does include children who were under the jurisdiction of the court, but they didn't actually leave their home. They weren't put into out-of-home care. So yes, that does include those kids.
Awesome, awesome. Thank you. And finally, why do we surmise some people, 13, 15%, aren't making the child abuse reports? What are the barriers?
I'd say, some of the biggest things that I see with that, I mean, the obvious things are that the mandated reporters, like teachers and doctors, are the ones who are typically noticing the bulk of abuse and neglect, and they're trained in identifying it. They're mandated to report those things. So I'd say that's the huge one. When we look at data on who's reporting, who's making the reports, there's a huge decrease in teachers and school staff making those reports, but there's actually a 13% increase in neighbors making reports during that year that included the pandemic data. So, obviously there's other people who are still seeing these things happening, but obviously a huge barrier would be that when there aren't the typical mandated reporters, seeing these things, it's other people who maybe don't know what are the rules around calling and making a report, or how sure do I have to be to call in and say that I think that there's abuse going on. So I know in LA County, the LA DCFS did some public service announcements to kind of say, hey, everyone in the community, kids are at home, so we all need to be looking out for this now. So I know that there were some areas that were doing, kind of pushes around that of making it clear to just neighbors and community members that now they need to try to be the eyes on kids. Teachers can't see them as much. So hopefully that answers the question.
Definitely, I believe it does. And thank you so much for your information. I will be in contact as the facilitator for the COVID-19 Learning Exchange Cohorts. And I know your information was super interesting. So hopefully we'll see you again. Thank you.
Thank you.
All right. Any last questions about CFRA, about anything else before we close out for the day? All right. Well, I just want to thank everyone for spending your morning with us. And also just sharing all of your experiences with each other. We really appreciate that. If you recorded your conversation, but it was not able to be entered into the Google Chat document, you're more than welcome to email me. I will actually put my email in the chat, what your group discussed, and I will actually put it in there for you. So I'll leave that up in just a second. And again, thank you so much for joining us today, and we hope to see you again soon. Please look out for a flyer and also on our website information about upcoming events. The next webinar in our series for our learning exchanges will be about building community resilience, community engagement, and that will happen in February. Our one after that is going to be on equity. We are so fortunate to have Dr. Jessica Price, who's a national expert on disproportionality in the social welfare system, joining us. She has a TED Talk, so we're so excited to have her host our webinar on equity. And if you log on to strategiesca.org, you can join our newsletter mailing list, and we will be sending information out when those webinars are finalized. So again, thank you all. Thank you again to Danielle and to Merritt for sharing today, and to the whole Strategies TA team who have been here to support you all. Thank you so much. Goodbye, everybody. Take care.